We are here to talk about food post-lunch, so hopefully no one is in a food coma as we talk about food systems. My name is Dr. Manasa Mantravadi, and I am a physician turned entrepreneur, really working in the food as health space and transforming systems in school cafeterias. So I'm really excited to be here today. It's going to be really informal with some friends I have. Zack I've known for some time, and Veleké. we just met, so we're going to keep this really informal and really talk about the impact of food systems and how we can kind of impact communities at scale through food, which is my favorite topic. So instead of doing intros, what we decided is we're going to jump into some of the 60-second kind of elevator pitch, so you get to describe exactly what you do and answer your question at the same time, huh? So let's see. The first question I have is to kick off kind of this conversation about food systems is, in 60 seconds, first you can tell us about your story and who you are, where you're from, what you do. But in 60 seconds, what moment made you realize that food systems needed to be rebuilt? And then kind of how you, based on your story, re-envisioned that.
Well, I grew up on 300 acres in Northern Virginia, right outside of D.C., so we were just kind of caretakers, of it. So I've been around agriculture. I mean, we were not farmers by any means, but we had pigs, chickens, horses. I worked on my neighbors' farms. Fast forward to 2015, I was on the losing end of a, partnership, kind of lost everything. I have 5 kids. It's like, what is next, of what this looks like for me. And it was literally just a PSA that, Scott Avett from the Avett Brothers was on NPR and talking about farming, and it just, something hit me. And I think anyone in this whole room spent an hour, talking to a farmer, and then spending another hour just researching online around our food systems and health systems and environment. And it really just kind of hit me over about a month of every problem we have on Earth starts from the dirt. And unless we go all the way back to the dirt to start rebuild these systems, we're never going to get anywhere. So it was really, the vision is just looking up at the sky and just seeing this virtual Manhattan-sized meteor just inching its way down. And it's like, what are we going to do about it? We're never going to litigate out of it. We're never going to get at it from a policy standpoint. We literally have to go back and rebuild a food economy that supports our farmers, supports our health, and supports our environment. And it is not to do it for any of those things. It's to do it for us. It's like, I always look at people, you're doing this from a selfish perspective. Like, we're not trying to save the environment for the environment's sake or the planet's sake. We need to save it for our sake. So that's really in a nutshell.
You want to go next on what was your aha moment and kind of your journey? Introduce yourself. What was your journey? And then when did you really realize, like, food systems is an incredible opportunity to change communities?
Well, you took me back with your story. Because some of my friends are here. I'm located in West Palm Beach, but my roots are from North Carolina. I'm from Virginia, but both sides of my family, North Carolina, we still have our farms. And on my father's side, we have still maintained our original 40 acres from slavery. So I, too, grew up with pigs and horses and everything, in that essential ecosystem. And on my mother's side, my grandmother always grew her food, and when we moved to Virginia, she brought it to us. So I've just always been very healthy, and I realized that the healthiest food came from that in which you control. And fast forward, moving to Palm Beach County 11 years ago, we have a nonprofit called eRoadmap, and when COVID hit, we decided to narrow our focus. And that aha moment for me was during COVID, where in Palm Beach County, I saw the longest food lines ever. It was horrific, but I also had an opportunity to take a look at the food that was in the boxes. And the food represented processed food, shelf-stable food, high sodium, the same foods that are driving these issues such as diabetes and hypertension in those same zip codes. Essentially, we were distributing crisis to people already in crisis and calling it relief. And I decided to launch a program called Operation No Food Gap that allowed us and empowered us to work with residents to grow their food from a food sovereignty standpoint. And it just continued to grow from there. So food is very important. Food is something that it is a fundamental right. But more than that, there's a right to understanding and to trust traceability in the food as well. And so I'm really excited to get into that with the panel today.
Excellent. And then my quick background is I'm a physician by training, I'm a pediatrician by training, and I did endocrinology. So I was on the treatment side. As we know, in general, American healthcare is skewed, unfortunately, towards treatment rather than prevention. And so was seeing a rapid rise of adult onset disease in children. So I was seeing 9-year-olds with morbid obesity, 9-year-olds with type 2 diabetes and sleep apnea, things that we don't typically consider childhood diseases. And so my aha moment was really counseling these families and these patients towards more of a food as health, but realizing very quickly that they didn't have the access they needed to get that kind of investment in their children's health. And so for me, transitioning from a treatment-based approach to food systems as really our primary healthcare system was my big aha moment. So it sounds like we each have some great stories that led us here. But Zack, one of the things we've kind of talked about, Charlotte has lost 100,000 acres of farmland. So how does Carolina Farm Trust rebuild that local food infrastructure in a city that's growing so fast?
Yeah, I mean, the hard part is there's not enough philanthropic investments or even government investments on Earth to go and buy easements and conserve farmland. And again, back to where all these solutions are is economics. So if a farmer is making money, they're going to keep on farming, and those kids are going to keep on farming. I mean, I think it's a very big myth that farmers don't want to farm, or there's a lack of the population that wants to farm. There is a huge part of the population that wants to farm, but farming is one of those unique things on Earth. I mean, it's about the same as starting an oil company right now and going to trying to, build billions of dollars to go build an oil rig. I mean, it's the land cost, it is all the equipment costs, it's how do I go to market. So what we're trying to fuel kind of is that distribution channel. So our farmers are making money and focus on farming rather than, only dependent on farmers markets. Farmers markets are amazing, but it's not a scalable solution for most of our farming community. So we have a 30,000 square foot facility that we have been building thanks to the American Rescue Plan Act and some congressional earmark funding during the past administration. And it's a 3,000 square foot commercial kitchen, about 7,000 square feet of cold storage. That's all operational right now. And so we're trying to build an economy with corporate food service. So just imagine Bank of America just shifting how they even procure their own food from a regional standpoint. I mean, that would be huge in itself. And there's a whole blockchain thing, that we're trying to, work on that as well. But it's about building this economy that you as a consumer, you at work, you can start really participating in the economy that we're trying to build. And so the phase 2 of the project is really a first nonprofit grocery store in the area, a teaching kitchen, event space, a meat processing facility. We have a 400 kilowatt natural gas generator that we have planned to make sure that if we ever hit a hurricane, I mean, Helene just made a left after Atlanta. It hit the western side, but if it didn't, we would have been directly hit. Food is an enormous national security risk, and we need to start thinking of it in that way. But really looking at the economics, because that's really the driving factor in all of this is just building an economic solution that you all can fuel with the dollars you spend every day anyway. We just have to build the infrastructure. And then I think Veleké can talk really, because the blockchain piece that she's kind of building is so critical. So why, and it's backed, by really important data where what we're doing is actually having a good impact.
Yeah, if you want to follow that up, Veleké, because I think that's a really important part. We're talking about infrastructure. I'll talk about kind of how it implements into health, but then in general for tech-enabled network changes, like how does that actually change who gets to participate in this food economy?
I just have to chuckle because I am a gardener, and on Saturday I will be digging holes and continuing to garden. But through I was searching for a solution with some of the challenges that we have in gardening, and that's what led me to tech. And when we talk about infrastructure and trust and traceability, that was important to me. It's important to know that you can trust your food, and I don't think we have enough measurements around trust in the food and traceability in the food, not just how far your food has traveled, but from seed to harvest. What is the nutrient content in the food? How many, just every point of accountability within the supply chain. And to your point, how does tech change access? The challenge is infrastructure, because growers know how to grow food. Growing food has never been a challenge. But if a grower is looking to have that relationship with a school district or a hospital to procure the food that they're growing, they need the proper infrastructure in place to compete. And a lot of that infrastructure has to do with compliance mechanisms like FSMA 204, traceability protocols, compliance, automatic compliance in that, but also to unlock some of the funding. Because when we talk about building resilient cities, the question is, how can you create more impact? And you want to create more impact by utilizing the funding that's coming into the circular economy in a circular way, right? So when I thought about building the tech, first tackling the trust and traceability too, but providing the access to the growers. So there's a piece of our tech that allows a grower to be paired with a payer, someone like American Heart that is looking to address health disparities in a particular city. But now we want to give that funding back to the local grower and also give them the tech that enables them to compete. Because I believe that we all want to go to the grocery stores that we frequent, like Whole Foods and Trader Joe's and Sprouts and all of these other places, and see your local farmers in there. Why aren't they in there? But they aren't in there because many of them can't afford the $2,000 USDA stamp proving that it's organic, but it's USDA coming in every single week to ensure their growing methods. So my tech proves the growing methods every single day so the end consumer can have that trust and traceability that they deserve.
I love that segmentation because trust and traceability is intricately tied with health and health outcomes. So we talked about infrastructure and now tech, and I'll bring it back to kind of health. The first largest federally funded nutrition program in the country is SNAP. Okay, it is very, very woven into our healthcare system. So physicians know about SNAP. We write scripts for it. You can go to produce and go use your script for it. Anyone know what the second largest federally funded nutrition program in the country is? Huh? Cafeterias. Look at you. School lunch. School lunch is the second largest federally funded. It feeds 30 million children a day. Okay, so more than 5 billion meals a year. And unfortunately, most of that is served in single-use plastic, heat and serve, ultra-processed food that is shelf-stable. And so kind of going back to me seeing children in the clinic, having these health outcomes that are significantly different than just a generation ago, and understanding kind of a mass-scale health intervention is truly food. Before the 1970s, before kind of the commercialization of school lunch, we didn't have these health outcomes. And if you look at other countries like Japan or like some of the Scandinavian countries, they're investing, their government is investing in school lunch as a real predictor of health outcomes. And guess what? Their health outcomes are improved. So, that's kind of the end game, but it's the infrastructure, it's the blockchain, it's the funding, it's all the other things that bring it to life. So that's kind of, I think, the third piece of thinking about food systems. I know we only have a few minutes left, and, hopefully there's a lot of, government people who can make some differences here. And if there's a mayor sitting in this room, if I speak loud enough, if every mayor in this room could do one thing tomorrow, what would you ask them for? And you're not allowed to just say $150 billion, because that would be great. But you can say money. It's okay.
Well, I mean, I think it's all priorities, right? So I mean, again, without our food and agricultural systems, we don't exist. So I think looking at it and saying, okay, we understand that food and ag is a national security risk, and we're going to take it seriously. It is not at the realm of possibility that diesel gets to $10 a gallon. And if we get 60% of our food from Mexico, another 30% from Canada, and the rest from Florida and California, we're already feeling it. And so I mean, to me, the biggest ask right now is take it seriously. The only reason why we went to the moon is because the Russians wanted to go, and the only reason why Artemis 2 went up there is because China wanted to go. So we have to kind of look at this and understand that the grocery store is an illusion. It's an illusion that we have abundance when we don't. So the biggest factor is understanding and all admitting with each other that there is a problem that we need to fix. And we can fix it with urban agriculture. We can fix it with infrastructure because we all want it. This is not something that we all don't want. We do want it. But we have to collectively, I think, demand for it and understand that it's not just the mayor's responsibility to fund it. It is our responsibility to fund it because we don't have to wait for government, the philanthropy, corporates. We don't have to wait for them to do any of these things. I mean, we're on a $20 million raise right now to actually build this system. That's not a ton of money when we're talking about building a whole system. We just have to do it.
I've seen his system. It's phenomenal, and it will impact the masses of people who don't have access to food or to medicine. And so that would make my life a lot easier.
And just one more thing to add is as we're kind of building this system, it brings so many solutions. Like you're going to solve your health problem. What typically public schools have the most land ownership in any county. We can convert that into agriculture. We can make sure all the food, the systems, the school food systems are vertically integrated. Organizations like us can manage it. The teachers can touch it. The kids can touch it. Culinary, entrepreneurship. I mean, there's so much that can be intertwined with doing this one effort, which is just really the cool piece of it. And IT plays a huge role, but it's a tool. And so it can really graphic design, marketing, taking a cucumber to pickles. I mean, there's just so many cool things, that agriculture kind of brings to the table.
What's your ask?
I'll give my ask and definitely want to comment on that. So my ask to the mayors would be, and this is a bold ask.
Go bold.
Okay. I would just ask that we stop solely funding food access programs and also consider funding food infrastructure programs that provide proof. Because see, here's the thing. Data is everything. And we know that there's just a strong correlation between the data and unlocking funding. So if you start funding infrastructure that can provide the proof to the health outcomes and the activities that we're doing, now that data can be used to unlock the funding, and now essentially we're back in that circular economy. Now, following back on your piece, absolutely. Within eRoadmap for the last 10 years, my local friends know that's what we do. Working with the school districts, we've built gardens, farms, all of that to prove that, to make sure that we are improving the tray and the cafeteria. And the challenge with it is, to your point, it needs to be more direct funding. We don't have enough funding around that. If we know that's the problem, less direct access will unlock funding to this particular line item. Because what I'm noticing with the schools that I'm working with, students, you all look so young. I don't even know how old you are. How old are you? Seniors, right. And do you have gardens at your school? You have one? It's not integrated, right. But even if you have a garden, and then the next step would be integration, and now you can talk about the STEM component. Now we can talk about nutrition education. Now we're talking about being good students of the environment. Now we're talking about food sovereignty, and now we're just killing the concept of a charity model, because we're learning to grow our own food, and then that can continue to go on to regenerative farming and so on and so forth. So the focus, for sure, all of us, the conversation should be about how important it is to continue building the school gardens and the gardens throughout the communities.
Yeah, I echo that. I think my one ask is to really start for all of us to be collectively thinking upstream. So we teach our children about ocean cleanups after the plastic has already impacted the carbon and the oceans. I have to prescribe metformin for a child who otherwise could have just been prevented with proper nutrition, right? And so we're constantly cleaning up the own mess that we are making. And so I urge our government officials, our consumers, our for-profits, nonprofits, students, we need to do it for them, right? Because this is the one planet we're leaving behind for them. This is the one health that they get to have based on choices we make. And so if we can start to make our choices upstream instead of downstream, you will choose better infrastructure, you will choose better technology, you will choose better allocation of funding to these things that go upstream. So
can I just
yes,
add to
please.
that? So the concept of retrospectively is true. In my research, when I looked at the health data in terms of kids, you may hear about if a program works for kids next year, maybe. And so when we started developing different aspects about our tech stack, what I looked at was the IEP concept and the Medicaid, because we know most mayors in this room right now have a Medicaid spend problem. How do we unlock that Medicaid? And you can't unlock the money without the correct data. So part of our tech deals with our AI nutritional agent that works with the nurses that come into the school that write the IEP, and now we're looking at it from a holistic standpoint. So if you're looking at the IEP from an early standpoint, saying, hey, this child is a little overweight, they have a chance to grow into diabetes. How can we expand the IEP program layered with this tech to address it early on? And then you layer in the tech to coincide with the tray that they're serving in the cafeteria, and now you have this longitudinal data set that has never been available, and now we're talking about change. So 100%.
Yes. Oh, preach. I love data because it drives decisions. It drives a whole lot of decisions. I know we're at time, but I just wanted to thank you, Zack and Veleké, for really coming to the table, the family dining table, the cafeteria table, whatever it is, to really help understand that food is the best kind of investment we can make in both health, in economic infrastructure, in environmental stewardship, and it really just does all start with the plate that comes from the land, with the farmer, getting to the right people who need it the most. So thank you so much, and thank you all for joining us.